Tomorrow marks the start of Mental Health Awareness Month, and New York lawmakers are looking at different ways to help those experiencing a crisis or substance abuse issue. News Channel 34's Karina Capabianca breaks down what's been in the works.
This year, lawmakers were able to reject the initial executive proposal for 5% cuts to mental health programs in the state budget. Across-the-board cuts had been proposed by the governor before the state received billions in aid from the federal government.
It's just unconscionable to even consider making cuts in a place where people's needs have actually gone up.
Outside of the budget, lawmakers are discussing how to make mental health services more accessible. One bill would allow the state to begin putting together the infrastructure to carry out the 3-digit national mental health crisis line. According to Senator Brooks' office, by federal law, states need to implement the 988 system by July of 2022. Glenn Liebman with the Mental Health Association in New York State says it's critical that a system be in place to provide an immediate response to someone in desperate need of services and supports. There's also a push to get more crisis stabilization centers up and running. The recently passed budget puts a blueprint forward to allow the state to launch these.
The same way you go to urgent care if you dislocated your shoulder but you don't want to wait in the emergency room, that's somewhere you can go in and out. We really want to normalize. You may need to go to a crisis stabilization center if you're in this, this red moment of substance abuse crisis or mental health crisis to get you to a cool moment.
Brooks says while these centers have been talked about amongst those in the mental health community for years, it's a relatively new concept to others. In Albany, Karina Capabianca.